I've been to 3 placements, and it revolves around some areas of the nursing practice. And the placements have been very, very vital to the knowledge I've obtained so far. My practice assessors and the supervisors have played a very important role. They guided me in the right process. They beginning of the placement, they mapped out like a goal plan on how to first off meet up the first initial interview, midpoint interview, and then the final interview. And then they encouraged us also to be able to book sports placements, like it's to know more about nursing. And then they check in with us as from time to time to know if we are getting the right knowledge in how to on our nursing practice.
I've been to a couple of placements and it all turned out to be very, very well. However, there are still some that turns out to be not so pleasant, and an example of that is when I was experiencing some marginalization. Actually, not from the staff or from the team. It actually comes from the patients, and then I was actually very worried or reluctant to report what was going on. I was just trying to live with it and say, I'll just see this to the end and then everything will be fine. However, I did realize that some of the team were seeing what was going on, and they were waiting for me to see when I was going to report it. But eventually, I think someone could not take what was going on anymore, and then an incident happened, and then the person took it upon herself to go report what was happening to my supervisor, that this is what just happened, and this is what has been going on. And then my supervisor took it upon herself to call a community meeting and address this with the patient, that what was going on was really not acceptable, and that will not be accepted on the ward, and then they need to do better, and then apologize to the student or apologize to Abiola that this what you've been doing to her is really not fine. And they came to apologize, and then I didn't even realize that I needed it to be acknowledged until it happened. So they came to apologize and say things, and that they didn't mean it, that it was going on. I didn't realize that this was what was going on. I didn't mean it that way and all. But really my supervisor acknowledging or taking it upon herself to help me see that this does not continue to happen really made the rest of my placement during that time go very, very well. And I really appreciate what she did for me. That
placement is a good thing. It's been a really positive experience for me, and I have been very fortunate in having good placements throughout my time studying. One thing I think that I want to stress is that Opal for us as students is stressful. It might just seem like a bit of a tick box or something that needs to be completed, but it's a big pressure for us. And one thing that I have found that was absolutely golden for me on a placement was being handed a schedule on day one that included all of my interviews, all of my interactions with my assessor, not only timetabled but given protected time. So it meant that I knew when those interviews were taking place, I knew that my assessor had that time, I knew that it was going to be a face-to-face conversation and it was going to be productive, and as well as giving us space to talk about good things, bad things, and actually help me progress in my training and placement. I know that can't happen everywhere. I know that in some places it's just not possible to have that protected time. But what I do think is important is that for us as students, we walk in and we know that this placement is important to our providers as well as us. It's never easy to walk in somewhere and us feel like we are stepping on toes or we're an inconvenience. So things like that, making sure that they know that our Opal is important, that we're welcome, that we're supported, makes us feel at home and makes us feel like we're doing something valuable, as well as learning, but also, being a valuable member of the team.
Placement for me has been a very good time for learning. It has afforded me very good learning experience and opportunities. I've had my good days and I've had my bad days. I've had placements where I've had assessors and supervisors really support me and make my learning very personal to them. I've had placements whereby they kind of see me grow, so they start me off with maybe 2 patients, 3 patients to managing a bay. They make me very independent, give me autonomy to work. So they give me like patients and they ask me, this is your patients for today. So you are doing everything, of course, within your capacity. The ones that you're not supposed to do, you report to the nurse to, take charge. During medication, they try to build my knowledge on medication. So when we're doing medication round, they will ask you, what is this drug for? What is the side effect? So all of this helps me to build my knowledge and my confidence. And then my assessor always tries to ensure that every day counts for me. So when I come to work, if I'm not working with her, whoever I'm working with, she will tell the person, this is what I want Frances to learn today. This is what I'm expecting of her. This is what she's supposed to do. And they make it very personal. And the good thing is that we have conversations afterwards whereby she tries to see if I know what I'm doing, whereby she observes my learning. For me, that has really helped me grow. It has grown my confidence. It has helped me learn a whole lot. So if there are times that maybe there's a skill that I'm supposed to learn and they're doing it in probably, let's say, the right side of the ward and I'm on the left side, she would tell the nurse on the other side that when you want to do this, please get Frances so that she can join you. And the good thing is that they also let me the opportunity to practice, not just to observe. So the things that within my capacity, they let me practice, and which helps me very much to, build my confidence. And then when I'm on placement and there is they help me to organize spokes placements that are related to that particular placement I'm doing. They call the ward or the unit, wherever it is, to try to help me organize that. And when I come back, we have conversations on it. These conversations really help me a lot because it helps you reflect on what you have learned, and it helps those things to stay. However, I've had few bad times, of course, and they usually stem from the fact that the wards are very busy. So some nurses don't really know how to carry students along because they are more focused on the patients. So, but for me, what I do to overcome this is that I talk about it, I communicate. If I notice that I'm working with somebody that is not carrying me along, I look for a good time and I speak to you about it. I tell you my expectations, my learning expectations, and I will appreciate if you can, explain a little more. Try to just appreciate the fact that I'm working with you and carry me along. And many times I find out that when I have these conversations, because of my proactiveness, I find out that they adjust. They try to help me, So generally, I would say that placement for me has been good. Yeah, and the few bad times I've found ways to overcome them.
Placements have been good, and I've had good feedback from the assessors and from the nurses sometimes. And then what I've noticed is that the nurses, the assessors, the supervisors, they have been really, really doing a good job. They've tried to carry along whenever they are doing whatever they are doing. Like if there's an opportunity to learn, they would like to call you and tell you, this is what we're doing, this is what we're doing, come and watch and come and learn. And then they also ask you questions to know if you're learning what they're saying, if you're learning what they're doing, if they're being thorough. That's what I've said. That's what I think they've been doing. And then at the end of the day, the supervisors or the assessors, they will call you and tell you, what have I been doing good? Where have you been having challenges? How can we make it better? Do you want to book spokes placements? And they'll tell you, okay, where do you want to see what more they are doing? Is it the dementia team? Is it the theater? Is it, they tend to carry along, and then they try to fix dates that you can do your initial placements, your initial interview, your midpoint interview, and your final interview. And in all those points and phases, they keep asking you, what do you want to learn more? Are we being thorough with your OPAL proficiencies, and how do you want to meet up with that? And at the end of the day, you go back to uni with more you have learned. You'll be confident in the skills you have acquired and seen being done in the world.
Another thing that I think would find helpful as a student on clinical placement is when we've been addressed by our names. Myself and my colleagues have come about and we've reflected on how most of all our placements were referred to as the student. I think we would find it very helpful if we're being referred to as our name. Like my name is Abiola, and I would love to be called Abiola rather than being called by the student, because I can recall on top of my head I was called by my name Abiola once on my placement.
A tip for placement moving forward for me as an MSc student would be for placement providers to either ask or to find out before we start what programme that we're on. For us as MSc students, we only have 2 years of placement practice with the university. So our time in clinical practice is much shorter, and there is an expectation that perhaps we should know more, and that's not always the case. Some of our students, particularly our international students, have never had a placement in the UK. They don't even know what the NHS is about necessarily in a physical term. So for placement providers to take that time to say to us, where are you on your programme? What experience have you had before? Is really, really valuable. And I think it makes us as well not feel quite so concerned about the things that we need to cover, and also will encourage us to ask for help in those moments where we think that perhaps things aren't quite what we need at that time.
One of the things I found very helpful in placements is the additional support that the BEATS team, they come in and check in every other week to see how you're faring, engage you in questions, ask you where do you want to go when you qualify, trying to put your head in the right space for you to realize your goal. I think it's very, very helpful in the sense that it takes a pause out of the whole rhythm of the world to actually engage you and self-reflect on how you can improve, on how you're going to gain more from placements. That helps the students, us the students, in learning our learning practice in nursing.